Most people lack intuitive understanding of probability and risk, making them extraordinarily vulnerable to misleading statistics about vaccine safety. Let's develop the statistical literacy needed to evaluate these claims accurately. The fundamental concept many people don't grasp is baseline rates. In any large population, certain events happen at predictable frequencies regardless of any intervention. In the United States, over 4,000 people are diagnosed with cancer every single day. That's the baseline, what happens without any special cause. When you vaccinate hundreds of millions of people, cancer diagnoses will inevitably occur in temporal proximity to vaccination purely by chance, because cancer is common and vaccination is common. This is where numeracy failures create vulnerability. Someone sees 333 cancers after vaccination, and it sounds alarming, but that number is meaningless without context. 333 out of how many vaccinated people? Over what time period? And critically, how does that compare to expected baseline rates? Let's do the math. Say we vaccinated 200 million people. Based on average cancer incidence rates of roughly 450 cases per 100,000 people annually, we'd expect about 900,000 new cancer diagnoses in that population over 1 year, or about 75,000 per month, or about 2,400 per day. So 333 cases isn't evidence of elevated risk. It's dramatically fewer than the expected baseline, if anything suggesting a protective effect, likely due to healthy vaccinee bias where healthier people are more likely to get vaccinated. Understanding relative versus absolute risk is crucial. Media coverage loves relative risk because it sounds more dramatic. Doubles your risk is terrifying. But if baseline risk is 1 in a million, doubling it means 2 in a million. Still extraordinarily rare in absolute terms. Absolute risk is what actually matters for decision-making, but it's rarely what gets reported. Framing effects are powerful. The same information presented differently creates opposite impressions. Vaccine increases cancer risk by 0.00001%, doesn't go viral. 333 cancers reported after vaccination, does, even though they're describing the same data. This is why understanding denominators out of how many people is essential. We need to ask the right questions when evaluating risk claims. What's the baseline rate of this outcome in comparable unvaccinated populations? What's the absolute risk difference, not just relative risk? What's the confidence interval around the estimate? How precise is this measurement? Has this finding been replicated by independent researchers? Natural frequency formats help with interpretation. Most people understand 1 in 10,000 more intuitively than 0.01%. When possible, convert percentages to natural frequencies for better comprehension. Risk comparison frameworks provide crucial perspective. Vaccine risks, even if real, need comparison to infection risks without vaccination. COVID infection carries documented risks of myocarditis, blood clots, long-term complications. How do these compare to the rare vaccine risks? We should also compare to everyday activity risks. The drive to the vaccination center carries measurable accident risk. Swimming has drowning risk. Every activity involves trade-offs. Simpson's paradox and other statistical illusions demonstrate how raw numbers can mislead. A trend appearing in aggregate data can reverse when broken down by subgroups, or vice versa. This is why crude comparisons without controlling for confounding variables are unreliable. The denominator problem appears everywhere in vaccine misinformation. Numerators, counts of adverse events, get presented without denominators, total exposures. This makes risk assessment impossible. Always ask, out of how many people? Over what time period? Compared to what baseline? Understanding statistical significance versus practical significance matters too. With massive sample sizes, tiny differences can be statistically significant, detectable above noise without being practically meaningful. A difference of 0.001% might reach statistical significance in a study of millions but be too small to matter for individual decision-making. Developing these statistical literacy skills doesn't require advanced mathematics. It requires asking the right questions, demanding appropriate context, and recognizing common manipulations. These skills are literally life-saving, enabling evidence-based health decisions rather than fear-based reactions to misleading statistics.